Alrighty, my name is Serena Meese, and I am going to be performing the eyes, ears, nose, and throat exam. Here is the room. Hello, my name is Serena Meese. I'm going to be performing an eyes, ears, nose, and throat exam on you. Do you wear any corrective lenses? Alrighty, can I have you hold this Rosenbaum chart about arm's length away?
Yep.
Can you read the smallest line that you can see for me?
LTFPH.
Alrighty, can I have you cover one eye?
Yep.
And can I have you read the smallest line but backwards?
Yeah. HPFTL.
Alright, can you switch hands and eyes and read the smallest line that you can see?
LTFPH.
Good. You have 20/20 vision. Alright, next thing I'm going to do is I'm going to wiggle my fingers, and with you looking just straight at me, let me know when you see them, okay?
Now.
Alright, can I have you cover one eye? Let me know when you can see my fingers wiggling.
Now.
Okay, cover the other eye.
Now.
Alright, peripheral vision is intact. I want you to follow my finger with just your eyes. Don't move your head, okay? Good. No nystagmus or convergence noted. Can I have you cover both of your eyes for me? Can I have you uncover one? Good. Go ahead and cover that eye again. Can I have you uncover the other eye? Good. No deviations noted. Eyes were straightforward. Came into focus. Next thing I'm going to do is kind of close your eyes. I'm just going to take a look at your eyelids. They are symmetrical. They're smooth. They're same color as your skin. Have you open your eyes for me? I'm going to touch your face here. I'm going to pull down look at your conjunctiva here. It's pink. It's moist. Can you look up for me? Good. Can I have you look down for me? Sclera is white. Eyes are symmetrical. Next thing I want you to do is I am going to come off to the side here, and I'm going to look at your cornea, and it is clear. It is no opacities noted in the left eye. Coming around to this side, looking at your right cornea, it is clear. No opacities are noted. I am going to shine a light here. Check your corneal reflect, and light is reflective symmetrically in both eyes. It is centered. I'm getting close to you here. Just keep looking at my nose. I'm going to check your pupils. Good. Pupils are a size 3. They're equal. They're reactive to light. They accommodate, and they're consensual. I'm going to darken the room a little bit now. Alrighty, darkening the room. I am going to look into your eye here, looking at your optic disc. It is pink, it is clear, your red reflex is present, and your no papillary edema noted. In your retina, I can distinguish between arteries and veins, and no hemorrhaging is noted at that right eye. Can I have you look this way a little bit? Alright, looking at the left eye here, your optic disc is clear, it's well defined, it's rounded, it is pink as well, no papillary edema noted, your red reflex is present. Looking at the retina, I can distinguish between veins and arteries, and I don't notice any hemorrhaging. Turn the light back on here. Moving on to your ears, looking at them straight on, they are symmetrical to your face. Could I have you turn this way for me? Looking at your left ear, it looks I don't notice any deformities or lesions. Taking a feel for it. I don't feel any deformities or lesions. Any tenderness when I was touching it at all?
Mm-mm.
Okay. Switching out my heads here. I'm going to touch your ear here. I'm going to lift up and back on your ear. Insert this in here. Looking at your tympanic membrane, it is pearly gray. I don't notice any excessive earwax. Your tunnel is not reddened. Your cone of light in your left ear is at 7 o'clock. If I can have you turn again, I'm going to come around on this side. Looking at your right ear, I do not notice any deformities or lesions. When I feel it here, I don't feel any masses or deformities. Is there tenderness when I touch it? All right, I'm going to pull your ear up and back again. And look in this ear here. As I'm looking, your tympanic membrane is pearly gray. Cone of light is at 5. I don't notice any excess earwax, and your ear canal was clear with no redness noted. Using my tuning fork here, I'm going to strike it. I want you to let me know if you hear it the same in both ears or if it's louder in one ear or the other. Same in both ears? Okay. For the Weber test, hearing is normal. I'm going to strike it again, and I want you to let me know when you stop feeling the vibration. I'm going to turn it, and I want you to let me know if you hear the ringing or not. Okay. Can I have you look a little bit this way? Strike my tuning fork. Okay. Yeah. Hear it? I'm performing the Ryan test here. Can you turn this way? Striking it again. Okay. Ryan test is positive. I'm going to stand behind you here. I want you to cover one ear, and when I'm going to whisper a word to you, and I would like you to repeat what it is.
Okay. Baseball.
All right, can you cover the other ear?
Popcorn.
Good. Gross auditory hearing is normal. Hearing is equal bilaterally. Looking at your nose, it looks symmetrical to your face. I don't notice any masses or lesions when I go to feel it. Is there any tenderness? I don't notice any tenderness, no masses, no lesions. Can I have you plug one nostril and take a deep breath in? Alrighty, can you do that with the other side? Nostrils seem patent. I am going to lift up your nose and take a peek inside your nose. Sorry. Alrighty. Looking inside your nair here. It is pink, it's moist. I don't notice any swelling. It's patent. Looking in your right nostril here. Same thing, it's pink, it's moist. It's patent, and I don't notice any swelling in there either. I am going to palpate some of your sinuses. I want you to let me know if they're tender or not. Okay. Palpating your frontal sinuses here. Any tenderness? All right, your maxillary sinuses here. Any tenderness? Okay. Looking at your lips. Your lips are pinkish red. They're moist. Can I have you smile for me? Your teeth are white. They're symmetrical. I'm going to touch you here. Looking at your gingiva, I don't notice any inflammation. They're moist, pink. Can I have you open your mouth for me? Looking at your tongue, yeah, stick it out. It's midline, it's pink, it's moist. Looking at your oral mucosa, I don't notice any lesions. It's pink, it's moist. Can I have you look up for me? Looking at the hard palate, I don't notice any lesions or abrasions. It's pink, it's moist. Let's stick this in here, sorry. Looking at the uvula back there. Turn your head just a little bit. Looking at the uvula back there, it is midline, it is pink, it's moist. Your tonsils are not swollen, they're pink. Your pharynx is pink and moist as well. Everything in your mouth looks good. Moving to, I'm going to palpate more of your sinuses here. Have you tilt your head just a little bit? Pull this back here. All right, palpating. I want you to let me know if you feel any tenderness when I touch them, okay? Palpating the preauricular here, any tenderness? Postauricular here, any tenderness? Okay, have you turn for me? This way. And can I have you kind of palpating your occipital here? Do you notice any tenderness?
No.
Okay, you can turn back around this way. Alright, palpating your tonsillar. You feel any? Alright, submandibular here, any tenderness? Submental, any tenderness? Alrighty, I'm gonna palpate your anterior cervical, no tenderness. Your superficial cervical, no. Posterior cervical. And then going on the right side, I'm gonna do your supraclavicular, any tenderness. Infraclavicular. And on this side, supraclavicular. Infraclavicular. Do you have any? All right, no masses or nodules were noted on those. And that completes my assessment. Thank you.